I'm Eric Jelovsek from Duke University, and I'm honored to have been awarded the 2020 AUGS Innovation Award. The focus of this innovation has been around the development of clinical prediction tools for the women we care for in urogynecology. It's really a culmination of work conducted by many talented national and international investigators in our field, and I want to take this opportunity to congratulate them as well. If I had to choose a single take-home message, I would say this. The best clinical prediction questions start with you and the patient. Just imagine if I had a tool that could provide me with this prediction for this patient, would it be useful? Also, when designing or reading a study about risk factors, ask yourself, would this have been better framed as a prediction model that was designed and evaluated for providing predictions for the individual patient? If so, this talk would have been successful. Thank you again, AUGS.